Welcome to the Mindful Practice Podcast, a space for physicians navigating burnout, identity shifts, and career change without pressure or judgment. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, coach, and writer. Here we talk honestly about what it means to build a sustainable career and a life beyond medicine and survival. Hello, and welcome to the Mindful Practice Podcast. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, coach, and author. Today, we're going to be talking about disability, equity, and inclusion in medicine. And I'm going to start with my own story about disability and the healthcare system. This story is personal, but it's also structural, because when we talk about disability in medicine, we often talk about it quietly. We talk about it privately. We talk about it cautiously. We talk about it as something to overcome, but we rarely talk about it as something that reshapes perspective, leadership, and systems thinking. So today, I want to share my journey, not for sympathy, not for inspiration, but for clarity. Today's episode is personal. It's about disability in medicine. It's about what happens when the system you trained to serve wasn't designed with you in mind. I am a physician with a disability. And when I entered medicine, I didn't think of myself that way. I thought of myself as capable, driven, disciplined, competitive, strong. I went through medical school, residency, hospitalist work. I performed, I delivered, I showed up. But what I didn't always talk about, what many physicians don't talk about, is the extra layer of effort it takes to function in systems that weren't built for your body. As you all know, in December 2022, I became disabled after a right below the knee amputation due to infection. Medicine has an unspoken endurance culture. Long hours, minimal rest, physical stamina, constant productivity, and very little margin for visible limitation. So when you live with a disability, even if you are high functioning, you learn very quickly that you have to prove your competence, minimize your needs, work harder to be perceived, work harder to avoid being perceived as fragile. There's a silent pressure. Don't let them question you. Don't let them doubt you. And don't let them see weakness. And that's exhausting. But here's what no one tells you. Navigating medicine with a disability sharpens you. It sharpens your efficiency. It sharpens your boundaries. It sharpens your empathy. It sharpens your systems awareness. Because when something doesn't work for you, you notice it immediately. And that recognition becomes insight. The culture of medicine and disability. Medicine is built on an endurance culture. Long shifts, minimal sleep, high stress, constant performance. But what happens when a physician develops a disability, has a chronic illness, experiences injury, has a mental health condition, navigates neurodivergence? Often, we don't build systems that accommodate. We build systems that test. And that contributes to burnout, early exits, quiet suffering, career pivots not by choice, but necessity. We lose talented physicians not because they lack skill, but because we lack structural flexibility. And that's very important to realize. For myself, when I became disabled, the employer that I had worked with didn't want to accommodate me as a disabled person. Ironically, though, they were willing to accommodate for someone who had a hip replacement or make accommodations for another provider who had mental health issues. So why does a physical disability mean that I cannot practice medicine? And I was literally told that I was not competent enough anymore after a right below the knee amputation to practice medicine. Ironic. The physicians who care for patients from all different backgrounds, including disabled patients, were telling me that I wasn't capable. I remember sitting in my car in the hospital parking lot, unable to make myself walk inside. That's the moment I realized burnout wasn't the problem. It was the symptom. Medical school taught us how to practice medicine. Nobody taught us how to intentionally design a career or a life that actually fits who we've become. That realization led me to build a simple framework. 5 steps I now call the 5 R's that took me from being an overwhelmed and uncertain physician to a clear, confident, and financially resistant one. I've walked this path myself, and I've now guided other physicians through it too. Physicians who didn't think there was a way out. If you're a physician who knows something has to change, I'm teaching this entire framework live and completely free. Go to the website below to save and reserve your seat. The truth is that over 3.1% of physicians are disabled, and they are capable and actively practicing as physicians, which includes myself. I didn't let someone's perception of who I was cloud my judgment or my capability as a physician. And to minimize or marginalize physicians that are disabled is a disservice to really exemplifying DEI in medicine. And that's what's ironic about my situation and the situation for many disabled physicians. I think as a disabled physician, I understand now what my patients go through, and that's helped me be more empathetic, to be more of an advocate for them, because I advocate for myself as a patient. And although I've always been an advocate for my patients, I think when you have that duality as a physician and a patient, which can happen to any one of us as we age, I think the important thing is that we don't lose sight that someone's competence and capacity or capability is not based on their physical, mental, emotional disability as perspective. Here's what disability gave me: perspective. It forced me to think about access, accommodation, efficiency, sustainability, systems design. It made me more attuned to the patient experience, more aware of invisible burdens, and more thoughtful about workflow design, more conscious of how small structural decisions impact daily practice. It expanded my empathy. It also expanded my systems thinking. And whether we realize it or not, we all work within a healthcare system. And even though the healthcare system is flawed, we still must try to provide the best care to our patients. The ironic thing is that after that employer was notified that I was disabled and was asking for accommodations, which they did not provide, I was able to secure another job and work full-time clinically for 2 more years. So their assumption that I could not practice as a hospitalist anymore was flawed. But because of the way that medicine and the healthcare system treated me and the medical community treated me, I decided to leave clinical medicine full-time on my own terms. And I've now pivoted into a hybrid or portfolio career where I do clinical medicine, medical expert work, utilization management, and coaching, which is much more aligned with my values and much more sustainable and fulfilling to me. Had that incident not happened to me, I don't think my career would have taken this trajectory. And that's important for people to realize, that sometimes things happen for a reason, and they help us take a moment to step back, realign our values and our purpose, and pursue things that are more in alignment and sustainable. The structural lens. Disability in medicine is not just an identity issue. It's a systems issue. Questions we should be asking. How do institutions handle accommodation? How transparent are processes? How safe do physicians feel disclosing? Are productivity metrics realistic? Do leadership models assume physical uniformity? Do promotion pathways account for non-linear careers? If we want sustainable health care, we cannot ignore physician sustainability. And disability is a part of that conversation.
What if the career you work so hard to build isn't the career you have to keep forever? If you're a physician feeling trapped, not because you're not skilled or dedicated, but because no one ever taught you there were other paths, you're not alone and you're not stuck. I'm Dr. Bertina Hooks, and I created the Phoenix Physician Freedom Blueprint, a 5-step framework physicians are using right now to move from burnout to clarity, purpose, and financial freedom. This isn't a theory. It's the exact roadmap I use to rebuild my own career. And it's already working for physicians who felt exactly like you do right now. Clarity, confidence, financial resilience. Join me live for free, and I'll walk you through the entire framework. Register now at the website listed below for the free live masterclass.
Let's reframe disability. Disability does not equal inability. It often produces adaptability, creativity, strategic efficiency, empathy, resourcefulness, systems awareness. Some of the most thoughtful leaders in medicine have navigated personal health challenges, but we don't always make room for those narratives. I hope that this podcast will be a space where we can share that. And over the next month, we will be talking about DEI in medicine from different physicians' perspectives. So I want to set the stage for this month. This month, we're going to go deeper. In the next episode, we'll be speaking with Lori Churn about her journey and into leadership. We'll talk about visibility, identity, representation, structural barriers, and what inclusion really means in medical practice. And later this month, we'll explore career transitions after disability, leaving certain surgical pathways, LGBTQ+ inclusion in medicine, and alternative career paths after health changes. Because inclusion is not one-dimensional. It intersects with identity, career stage, specialty, systems, and policy. Systems leadership. If we want to improve patient outcomes, we must also improve physician sustainability. And that's whether a physician is disabled or marginalized or not. Disability in medicine should not be whispered about. It should inform accommodation policy, leadership pathways, productivity expectations, wellness strategy, institutional design, because when physicians feel safe, supported, and structurally included, they thrive. And thriving physicians deliver better care. This month is not about highlighting difference. It's about strengthening systems. And I'm honored to begin that conversation with you. If you are a physician with a disability, visible or invisible, I want you to hear this clearly. You are not less capable. You are navigating a system that needs redesign. And if you are a leader in medicine, an administrator, a program director, a CMO, a department chair, you have a responsibility. Accommodation should not be exceptional. It should be operational and mandatory. Disclosure should not feel dangerous. It should feel safe. And flexibility should not be a weakness. It should be intelligent systems design. This month, I want us to move beyond inspirational stories. I want us to ask, how do we structurally support physicians so that sustainability becomes the standard? Because disability does not mean inability or lack of capability. It demands better systems, and if we build better systems for physicians, we'll build better care for patients. Thank you for listening. Until next time, I wanted to let you know that I have written a book about D in medicine, and this book will be released soon. It'll be discussing some of these topics, and to learn more, follow me on social media or subscribe and listen to the podcast for more information coming in the near future. As I reflect on my own journey, I'm also reminded that some stories take years before you fully understand why you had to live them before you could tell them. This season has been especially meaningful for me because I recently signed a publishing contract for my upcoming memoir, Fire to Freedom, a journey of transformation, renewal, and resilience. In many ways, this book captures not only moments like the ones I shared today, but the deeper journey of resilience, identity, healing, and becoming through personal adversity, professional growth, and life transitions that shaped who I am today. I will be sharing more in the months ahead as we move toward the book's release. But I wanted to mention it here because this story and many others live within those pages. Sometimes the chapters we survive quietly become the chapters we are later called to share. And if my story helps someone else believe that adversity does not disqualify purpose, then every chapter has meaning. Thank you for listening to the Mindful Practice podcast. If today's episode resonated with you, You can find free burnout and career clarity resources at pinnaclebusinessacademy.org. And if this podcast supported you, please consider subscribing or sharing it with a colleague who might need it. Remember, you are more than your white coat. You are not broken, and you are allowed to evolve. Until next time, take care of yourself, not just your role.